Are you constantly looking for your keys or trying to remember why you came into that room? Memory can be an issue for everybody, not just us older people. So how can we help our brains retain everything and stay sharp? Dr. Jenny Wilkins from AgeVital Pharmacy is here to tell us our very best memory enhancing products. Wonderful, Jenny. You're just in time. Before it's all gone.
Right.
So there are things that we can take that will make us remember better.
Yeah, number one, I mean, it's like a chronic condition right now. People, even young people, are suffering from memory loss, or they, you forget your keys, you forget somebody's name, you forget. So number one, you want to address like environmental toxins. Again, our foods, our water's polluted. You have heavy metals. Heavy metal is a big one right now. So things like aluminum, mercury, fluoride in the water, huge. So what that does is it's poisoning your brain cells. So it's blocking synapses, so those spark plugs in your brain, from making those connections for memory. So you need to have those little sparks, going off.
And there are things we can do or take to help increase that. So
yeah, exactly. Preventative.
Okay,
Preventative.
bring it on.
That's my
what
specialty.
Is this first one?
Bad habit prevention, right? So this is my favorite. This is something that I actually use. It's called Cemerelin Forte Plus. It's never too soon to start taking amino acids. I do have the Cemerelin Forte Plus in powder form, like the active HGH, but all this is amino acids. Amino acids feeds the brain. The more amino acids you have, the more brain food it's going to have. So your brain actually gets denser, meaning it gets heavier. So Alzheimer's literally means that your brain is shrinking like a raisin. There's nothing there. There's no protein. There's no nothing feeding. It's like a muscle, like when you see healthy muscles, you see all those proteins in there. So it's the same thing with the brain. You got to feed it the type of food that it needs.
So amino acids are good?
Yep, amino acids, amazing. So injectable little insulin syringe in the tummy. Take it every night before you go to sleep.
It seems painful, though.
It's so tiny.
Nope, it's such a tiny little insulin syringe. Yep. So
you
right
would
before
do
you
this-
go to bed,
you would do this
you
yourself.
inject your tummy. Yep. Helps you sleep like a rock, gets rid of collagen, and then you wake up, you feel rested.
And
So
you
it's
can
wonderful.
remember what you're supposed to do.
I like that
Exactly.
idea. I'm just nervous about the needle.
And I love it comes back to sleep too, because you have talked about sleep in the past.
Yeah,
so that helps.
It's amazing how everything works together.
And
What about
then-
this one? What's our next miracle drug?
This is like, I'm all about testing instead of guessing, like focus on the biology before the pharmacology.
Yes.
So this is our hormone testing kit. A lot of hormones are linked to Alzheimer's as well. So in dementia, in memory loss, Alzheimer's is not really a disease. It's just a pool of symptoms of not being able to connect, whether it's short-term memory, long-term memory, whatever it is. So this looks at all of the hormones as far as the endocrine system goes. So you want to look at testosterone and estrogen specifically for Alzheimer's, because that right there is what's going to help you. If you're deficient, you're going to feel tired and run down, and
So
then
this tells you if you might need
Any of these.
any of this.
Okay, what's the next one?
The omega essentials. The omega essentials, those are good fats, okay? Your body needs good fats for your brain, especially when there's a protein that's linked to the Alzheimer's called ADDL, okay? And then it inhibits you from absorbing those essential omega oils. Okay, so once you start putting those oils back in there and then you connect it with the amino acids, then you're getting rid of those toxic proteins that are building up. So it's
you
kind of
need
like
both.
the rotor-rooter for the brain, right?
You
want
need
that.
both of these.
Yep, exactly.
And both of these help in other things, too, though.
Yeah,
So it's not even just the
essential
memory.
oils for good cholesterol, for bad cholesterol lowering,
about
for
this
skin
little guy?
conditions. That's one of my most popular. It's a neurocomplex. The neurocomplex is loaded with all the B vitamins. So folate, it's got the paradoxal 5-phosphate, so B6, and then B12. Those amino acids are neuro too, so cellular and neuro. So again, full body, focusing on the body as an integrated whole as opposed to just little pieces of the system. So everything plays a part, in our metabolic physiology.
All of the above. But I want to talk to you first. AgeVitalPharmacy.com.
Yep.
Or we can go to St. Armand's to your store.
We actually just moved from St. Armand's. We're no longer in St. Armand's. We're 100% on Main Street now.
Main Street.
Yep.
Thank
So,
you, Dr. Jenny. See
Thank
you at
you.
Main Street. And next, Nikki's going to tell us about how to have a good relationship.
Try my best.
Can't wait. We'll be right back.
Start by